Hi, my name is Emma Gauthier, and I'll be talking to you about different ways that we measure or diagnose narcolepsy and symptoms of narcolepsy. So, when it comes to measurement, there are typically 4 different symptoms that we look to measure in our scales and tests, and those are excessive daytime sleepiness, also known as EDS, cataplexy, which is the sudden loss of muscle tone due to strong emotions, sleep paralysis, and hallucinations. And some different ways that we test these are the multiple sleep latency test, or the MSLT, the narcolepsy severity scale, the NSS, Epworth sleep scale, the ESS, or maintenance of wakefulness test, the MWT. So I'll be talking a little bit about those, and the first one that I wanted to start with was the multiple sleep latency test, because I feel it's quite different than the rest of them. It's more of kind of an experiment to test the amount of EDS that you have. So the way that it works is it was originally used by Mittler and his colleagues in 1979, and it tests each patient by having them take a series of naps throughout the day, a minimum of 4 after having a good night's sleep, and that'll usually be tested by polysomnograph. And what they're looking for is the onset of the REM cycle during their sleep and how quickly that they do fall asleep. So usually if you do have narcolepsy, you'll be measured by falling asleep within 8 minutes or shorter. And within 2 of those sleep cycles, you'll fall into REM relatively quickly. So each of those naps is usually 2 hours long, with at least an hour and a half to 3 hours between each one. And the other one that I was going to talk about is the Narcolepsy Severity Scale, which is a much more recent scale that was used by Dwyers, I'm sorry if I butchered that, and his colleagues in 2017. And it's basically a 15 item self-administered questionnaire that covers each level or each symptom of narcolepsy that I mentioned earlier. It's the only one that I found that actually covers all 4 of them at once. And so it is designed to assess EDS, cataplexy, hallucination, sleep paralysis, with the addition of disturbed nighttime sleepiness. And the results will range from 0 to 57, with the higher end of the scale being more frequent or more severe narcolepsy symptoms. And this one is especially useful because it is good for finding changes between treatments. So before and after treatment, you can tell the difference in this, and it's been tested by multiple other sources that I found, but Dwyers and his colleagues did it originally in 2017. And with the Epworth and sleepiness scale and the maintenance of wakefulness scale, they are also questionnaires designed to determine a specific level of excessive daytime sleepiness, the same way that the multiple sleep latency test does, except it's just a self-administered test in the same way that the narcolepsy severity scale is. Thank you.